Thank you so much for joining us for this panel discussion on how college collaboration can solve the healthcare workforce shortage. You've all heard it. Every month for the last 7 years, we've seen healthcare robustly add jobs in spite of everything else. The problem with adding jobs is finding the talent for those jobs. So today we're going to be blessed with two amazing colleges in the San Antonio area and a great employer to really talk to us very specifically about a job in that we would call an allied health position called medical assistant. And did I get that right, ladies?
You did.
And I want to make sure that we'll talk a lot about this, but for those of you who aren't healthcare experts, what does a medical assistant do? Everything. I mean, they do administrative work, they do clinical work, they're patient facing, and they are in every single place where you find medical allied health workers. So let's get started. I'm going to introduce my panel, and then they're going to talk a little bit to give you some idea about what they do and how they did this. First, I'd like to introduce Jonette Montano, who's the provost and chief academic officer at the College of Health Professions. And they serve all of Texas, not just San Antonio, and probably outside of Texas. Then I have Sammy Morrell, who's the associate vice chancellor of operations and economic and workforce development at the Alamo College District, one of the largest and most innovative community college districts in the country. If I may editorialize that, Sammy, I apologize. And finally, the most important piece of this puzzle is the employer. And representing employers today, we have Carl Negley, who's the chief administrator of the San Antonio Vascular and Endovascular Clinic and Mission Surgery Center. That was a mouthful for me, Carl, but I think I got it right. I wish I could have used the acronym, the SAVE Clinic. So, if I could ask Joni, you to start, just telling us a little bit about you, the college, and this wonderful partnership.
And thank you, Jane. Thank you for the introduction and thank you for. So like you stated, my name is Jody Montano and I am the Provost and Chief Academic Officer for the College of Healthcare Professions. Short, we call it CHCP, and I'll refer to it as CHCP from now on. So CHCP was founded by physicians over 35 years ago, and that's a little bit of a unique background that we have. So the physicians group was McGregor Medical Associates, and basically what they're trying to do, they were trying to train their own medical assistants for their own clinics because they were having trouble finding medical assistants that were skilled for their field. So basically 35 years ago, the same issues that we're having right now, which is very interesting. So since then, we've grown and we've become really the largest provider of allied health training here in Texas. Like you stated, we have 9 campuses throughout Texas. We have 2 campuses in San Antonio area, but we're in Austin, Dallas, Fort Worth, McAllen, Houston. So certainly we have grown since our 35 years. We really focus on allied health professions and programs, meaning that any supportive system for the medical field, we do the training. So basically anything from medical assisting to phlebotomy to medical billing and coding, surgery technicians, ultrasound technicians, and many other actually pharmacy technicians. So we have a number of allied health programs that we focus on. What makes us quite unique, besides how we started, is that we do offer our training programs in a blended environment. What that means is that our students, most of our certificate adult learners that come to us, they come on campus 1 or 2 days a week, depending on their program of choice, to do their skills and their hands-on training. And the rest of the time they are learning in an asynchronous online environment. What that does is really, it really affords our adult learner student the flexibility to balance life, education, and family that we all have, right? We all have to balance those things in our personal lives. Besides being a flexible training facility, we also focus on building stackable programs for our students. meaning that a full certificate program can fold into an associate's degree if the student wishes to continue their education, or a bachelor's degree after their associates. We do it in bite sizes, allowing for the student to be able to be working in field while they attain their degree. And I think that's really important because most people, you have to choose between education. Do I go to school or do I work full time? So sometimes, if you find the flexibility, you won't be able, you won't have to make that choice and you'll be able to do both. So that's a little bit about CHCP and what we do. And I think because of that flexibility and us doing it for so long and focusing on purely allied health, it became a very natural relationship to have with Alamo colleges. And Dr. Morrell will talk more about that relationship and how it started. But it really has a lot to do with how we have put our programs together.
Well, it's so great because, we're at Kale, right? We're at the Kale conference. So everybody here is focusing on adult learners and that speed to degree, that ability to have stackable credentials so I can earn more while I'm learning more, and so that I can build my resume at the same time I'm building my academic credentials. I think it's great. Sammy, could you tell us a little bit about Alamo colleges, if there's anybody in the world who doesn't know about them?
Sure thing. So Alamo Colleges is a district. We were made up of multiple colleges, independently accredited. We have 5 colleges. We have 6 education and training centers. We act like a network of education and training throughout San Antonio and the region. We serve 8 counties. We're the largest education and training provider in this region. Just to give you an idea, on the academic side alone, this fall, we were over 77,000 enrollments. So we have a significant portfolio, about 350 degree and certification programs. And that is also made up of continuing education, accelerated programs as well. So I'll talk a little bit about not only, so that's our makeup, right? Those education training centers are also, they act like platforms in our communities to get people back on track for education and training. So we have anything from, I think this is a beautiful quote, where we can go from an English as a second language, a GED program, all the way now to a bachelor's degree.
Beautiful.
So we now have 4 bachelor's degrees across our network. And we also have multiple transfer advisory programs with different institutions, 4-year institutions in our area. So we can take you from needing a GED all the way to a bachelor's degree, which is pretty significant. I'll touch a little bit about Train for Jobs, which is what really propelled this relationship with CHCP. And personally, just to know, because I know people are going to probably ask this, Jane, like, well, how unique this partnership was, but my family owned for-profit schools when I was growing up, a network of them, and I knew their mission. I know their mission. I know the mission as a network. I also sit on the workforce board, so really identifying the ecosystem of workforce partners is important to me when we talk about scale. So on the cusp of this partnership really was, think about COVID and right after COVID, right? So the impact to allied health during that time, economic recovery needed within our city. San Antonio is the 7th largest metropolitan city in the United States, yet we are also the 3rd most socioeconomically divided in the United States, right? So that was even before COVID. So when COVID hit, our city did something very innovative. They took over $64 million in recovery funds and reinvested it into education and training for our community members. So we were one of 4 prime partners at that time, Alamo Colleges was, to be on the cusp of economic recovery in San Antonio through a training program that also gave stipends, $15 an hour, while individuals were in that training. So when we needed to scale, right? Because we were at that time needing to serve 2,000 individuals through that training program within a very short period of time. And we knew not only the healthcare employers needed that, our families needed that to think about the role of allied health right around COVID and right after COVID and even now, like you said. We had about 13.5 million in funds from the city of San Antonio. And that's really what spurred the thought that, number one, I can't do this alone, right? So if any education institution thinks that we can meet the need, just thinking about medical assistants, we need 2,000, over 2,000 in San Antonio. I don't have the capacity to produce that much talent in the short time that they're needed, right? So that's where we really tapped into the ecosystem and partners that we already had relationships with, like CHCP, and said, what can we do? And the other piece I'd tell you is what's best for the individual we're serving, right? So what works on their schedule, what works around the barriers that they may have. Sometimes we think about our programs and what works best in our facilities and our faculty. But when we get individuals that come through our door, we need to meet them, where they are and what their needs are. And that's really what spurred this relationship is we cannot do it independently in the ecosystem. And I think doing it independently is what causes us not to do things at scale effectively. So that's, I just wanted to touch on what kind of for Train for Jobs, what really spurred the relationship and really an ongoing relationship with CHCP.
That's great. I mean, and you hit so many things that we'll come back to, because I think if I were listening to this and didn't have the knowledge that I have of both the community college system and CHCP, and I will call out CHCP is a for-profit school. I don't know that they make any profit at the prices they charge, but their tax status is for profit. So speaking of tax status and it says employer, right? So Carl, tell us a little bit about, I'm going to use the acronym now that you're using, the SAVE Clinic.
Yeah, thanks for having me. I'm real honored to be here, and it's great to be with a couple of folks that we're actually very well partnered with and aligned with as well in the community in CHCP and Alamo Colleges. I'm Carl Negley. I'm the administrator of the SAVE Clinic, and we are a vascular surgery practice that specifically focuses on the areas of San Antonio that are traditionally underserved, overlooked, under-resourced. And that unfortunately leads to a lot higher prevalence of vascular diseases, blocked arteries, and the strokes and heart attacks and leg amputations that arise from that. And so as a small private practice, we started with 8 employees in 2018, and we now are at 28 employees. We have as a vascular surgery practice, I'm the administrator, but as a vascular surgery practice, we do everything from diagnostic medical imaging with ultrasound and x-ray to in-office procedures like angiograms and stents and balloon angioplasty, things like that. And now we graduated to having a surgery center called Mission Surgery Center, the only Medicare accredited surgery center south of downtown San Antonio. And we can do things like dialysis access fistulas and creations. We can do a lot of the smaller podiatry, eye surgery, just the day surgery stuff that we saw, especially during COVID when a lot of places couldn't do outpatient surgery anymore. That's really what gave us kind of the impetus to be like, we need to look into this and see why don't we have those resources down here on the south side. And so we're really getting the ball rolling on that now. And so that opened up the door to needing more things like surgical techs and sterile processing techs. And of course, we have x-ray techs and nurses. So we really, even though we're only an employer of 28 employees, I think we have 15 different categories of employees that are here in the office with us. And so it's been a real struggle, like was mentioned earlier, we have plenty of jobs, and we have more jobs even still available, but it's the challenge is finding that pipeline, that workforce pipeline. And San Antonio's done a really good job with programs like Ready to Work, and then the programs that we've talked about already here with Alamo Colleges and CHCP. We've been involved in both of those. So we've really benefited from having the stipend of the $15 per hour in an employee that was was coming from just the restaurant industry, just the service industry, and wanted to do something different. And she was able to get into a program with Alamo Colleges, which I think placed her at CHCP. So that's all one nice big web. And then we got to host her as that employee and got her through the training program. She got her certificate. Now she's continuing that into an LVN program, which she intends to continue further into an RN program. And so if we could do more of that, then we would be able to, I think, really kind of fulfill the needs that we have for the staffing challenges that we face. But the idea is just we have to continue to develop those partnerships and make sure that we're made aware. what we see sometimes a lot is that the bigger employers get a lot more seats at the table for things like that. So like the hospital system may have a program where they have 50 people going through at the same time, and they get to pick and choose. And I'm just going to them asking like, well, give me somebody you didn't want. Like you can only fill so many seats. So how can I get involved in and even that sort of a way into that pipeline? And so I think that I'll be happy to share anything about my experience when it comes to going through those types of programs and what it's like to be on the employer side of that. And speaking of adult education myself, I have an MBA, but I didn't get it till I was 30. I didn't get my bachelor's degree until 2 years before that. So I remember I was one of those that took off out of high school not knowing exactly what I was wanting to do, but fell in love with the healthcare industry and trying to find ways to take care of people or enable other people to take care of people. And that took me back down the adult education path myself. So anyway, like I said, I'm really, really glad to be here, and I look forward to continuing conversation.
Well, thank you so much for sharing that, because a lot of people who are in the audience didn't go right to a 4-year residential college at 18, and they need to hear that. Look at the amazing success that you've had. Not many people get an MBA in 2 years. Thank you very much. Most of them, as a working adult, they take a lot longer than that. And, I think one of the things we often lose with employers is unfortunately, vascular disease is not going to get smaller. I mean, we're not going to have fewer people with vascular disease in the future. We're going to have more. So you're going to see the kind of growth you saw from 18 to 24, at least that kind of growth as you get to 26 and 28. And how do you get the talent that you need to grow that business? So thanks so much. I really appreciate all of you, but really your honesty about everything. Thank you. I'm going to go back, Sammy, to you and dig a little deeper into how the partnership happened, because clearly, I mean, not just because of the difference in tax status, but we all know that colleges compete, especially right now. Colleges are competing for the best students. They're competing to build their enrollment. In healthcare, they're competing for clinical slots, right? I mean, there's so much there. Tell us a little bit how you put all that aside, all the traditional Hatfield and McCoy things that go on from one institution to another, and really went to the need of the community and built that talent pipeline.
So I'll start with the question about competition, right? And our chancellor talks about this a lot, and I'll take it from him, is our competitor is poverty in San Antonio.
Wow.
So we're competing against intergenerational poverty. Our moonshot is to partner to end poverty in San Antonio and the region. One of the ways that we were able to do that, and I think that spurred that in Train for Jobs, and even now in the City of San Antonio's Ready to Work program, is if you're a contractor on those to do intake, success coaching, right, career services, we are to be training provider agnostic based on the approved training providers. But in another lens, right, we have a relationship with CHCP. I'm on the workforce board. I represent education. We have healthcare collaboratives. CHCP is always at the table. And then going back to what I said earlier, if my team in one of those education and training centers is intaking someone and doing a true comprehensive assessment about best need, best fit, I have to look at what other providers have the hybrid program we just discussed, right? It may be a longer program, but this is a working mother that needs to take a little bit extra time because they're balancing. Our program may be more accelerated. So we make options for individuals. And that's, to me, what spurred that is also to think through the lens of what's best for our community. What are we really competing against, right? And then how do we better leverage each other in the ecosystem to make a true impact in our community? Because I tell people all the time, you should be mad that we're number 3 in the most socioeconomically divided when we have this funding. So we haven't figured out the puzzle. And if we try to keep all the toys, right, and hold them tight, we get what we have, which we haven't changed the face of education attainment in our region. And that's our job, is to do that and to partner to do that. So the other thing is we had a Department of Labor apprenticeship grant that we partnered with CHCP on too. So then you create a trusting relationship across that ecosystem where our partners at CHCP opened up some of their employer partnerships to us because we had this other prior relationship. So we came together to say, all right, what employer partners can we have on the DOL apprenticeship grant? So we had a healthcare apprenticeship grant for about 3 years as well that CHCP was a major partner on with other allied health programs as well. And then getting to know that team. So we didn't do this just by me sitting in this desk or my teams. My team went out to the site at CHCP. They met their teams. We had ongoing communication with all of their team members at different levels. So we knew how they took care of the students when we would refer them. And quite frankly, it was really great. They invited us to their celebrations as well. And just to build that type of trust and then to think about other initiatives we could do to continue to scale the work. Right. So then what's next after an MA, like Carl said, right now as an LVN, we need to create a system that breaks down barriers and doesn't create barriers. Right. So whether that MA is coming out of whatever training program, they have a credential of value. And how do we truly make it stackable across, our system that someone can come in that door now? And those are still barriers that we're talking about across different partners to build. So I know I went kind of off, but that's how we continue to build an ongoing relationship, right? One of the campus directors is always at the healthcare collaboratives. We have regular meetings with them. We have other type of programs that we continuously reach out to them because we know we trust them because they produced, right? And I think they trust us because we are continuously referring and trying to build a better system for our community.
Boy, I'll tell you, that trust comes out in everything you're saying. And I see Jonit shaking her head, feeling the same way, right? You trust them.
Oh, absolutely. It's such an interesting, I'm so glad that Sammy, Dr. Morrell had such an open mind, and she was very innovative and really thinking outside the box and reaching out to this relationship that we had. It wasn't automatic. I just want to make sure that they were incredibly careful and very intentional with the partnerships that they were looking for. We really started with a pilot, right? We like pilots, it's a controlled group, and we really wanted to ensure that with these adult learners that we wanted to make sure that we had our wraparound services, that, and if there was a gap, that we certainly were able to put something together and build that structure around them. So we started with a group of 11 students as the initial partnership. And we really wanted to be intentional with their education program and ensuring that they were going to be successful, whatever that looked like, right? Because for us, it's incredibly important to meet students where they are. That is our mission, and that's something that we live by. So basically, we started with 11 students. Our students had incredibly challenges throughout their trainings, from losing family members to just incredible loss, incredible challenges. But we were able to really work with them, and in partnership with Alamo College, obviously, and we would share them with the Alamo group to ensure that they knew where their students were and how they were really doing in terms of their educational pathway. 9 months later, or a little bit more, we were able to really graduate all of them. They all finished. Retention was 100%, and they all got employed in field. So that's 100 for 100, which is what we were going for. And then after that, we said, okay, we can definitely do this. Is something that is scalable. We have the wraparound services that the students are going to need. So that's how it started. So, you know, it seems like an unnatural relationship, but it really has worked and it really has flourished into their students going into other programs, not just medical assisting, but other programs in our system as well. And we actually have one of them that is stacking. I don't know if you knew Dr. Morrell, but they are stacking into the associate level. So that's incredibly exciting.
That is exciting. So I want to go to something, I want to go back. We should have probably done this earlier. And Carl, I'm going to ask you to do it. You know, I glibly said that a medical assistant does everything, but could you talk a little bit about what a medical assistant does in your practice and why they're so important to your practice?
Yeah, it's a great point to make. There's excuse me, there's sometimes a common misperception that medical assistants do blood pressures and talk about the medication reconciliation, and then they hand them off and that's it. And they couldn't be further from the truth, really, especially in our experience. But we might stretch medical assistants to their limits in the way that we incorporate them into the practice. And I'll tell you what I mean by that. Medical assistants in our practice can really do everything from greeting a patient at the front and then getting their registration, insurance information, everything that they need to make sure that they're ready to be seen and properly intaked into the system. And take them down the hall, put them in a room, and go through their entire medical history. We are doing the blood pressure and medications, of course, but then we're also getting ready to start like the educational process. And while we're getting the patient and familiar with them in the room before the doctor comes into the room, we're already getting them familiar with what types of patient education materials. If you can see on this wall, I have a whole wall full of materials in each of our exam rooms where we talk about things like smoking and diet and exercise, of course, all the preventive things we should be talking about, but also all of the treatments that we could be looking at, and we expect our medical assistants to be well versed in that in English and in Spanish, so that no matter what the family or the folks that are here with the patient too can all be engaged in that conversation. And essentially at that point, the medical assistant has to be ready at any moment. The doctor might walk in the room and essentially just take over that visit, at which point they become almost that scribe function where they might need to keep up with the doctor on what their physical exam is looking like and what they're finding and what the next plan is going to be. And then help get that documented, and then they'll switch back places, and the doctor will decide what they would like to do for next steps, and the medical assistant finishes up the entirety of that visit and then gets them scheduled for their follow-up. And a lot of the things that happen during that visit are things that have to be continued after the patient's gone. For example, we might need to refer them back out to a podiatrist or to wound care or to home health. And how do we get them there, and how do we make sure that happens? How do we follow up to make sure it happens? And if they have if they're going to have a surgery, they might need some CT scanning or MRI scanning that's going to happen outside of our office, and we need to make sure that they're following through with that process. And so there's a lot of the hands-on patient care as well in terms of wound care and little minor procedures, staple removal, suture removals, those sort of things that they do. But at the end of the day, they're so well-rounded by the time they leave here that most of them would say that every other job's a little bit easier than this one, I would say. But the scope that they have is so broad. It really is. They really are like the most essential functional unit of a private practice like us. And we I think they feel rewarded too, though, by being able to be a part of all those other things. We even have, since we have that surgery center I talked about, we can even train them in that patient care technician or PCT role, I think is what it's called in the technical area. But helping the nurses as the nurses' right-hand people with the patients in their acute care setting before, during, and after the procedures that they have here in the surgery center. So the scope is so broad. I like to try to position us to where almost all of our employees are medical assistants, and then we have nurses, and then we have PAs and NPs and all the different technical groups. But there's almost the medical assistants can do so much that they can be cross-trained to do so many other things also, that they just are like they're the troopers of the healthcare system.
What amazing on-the-job training it is, getting exposure to all these different aspects of your office. I mean, it's the best part of a small business, right? You learn all aspects of the business.
Well, and it allows us too to give them that opportunity to see what do they want to do next. They can have exposure to so many other things, and we encourage them to go back to school and engage in the programs that Dr. Morrell and Jeanette are talking about, so that we can continue their education too and be flexible in the way that we do it. And we like to be that employer that if you can get to work, then we can find out the times, we can figure out the ways to get you back to school and how to do it. If they're dedicated to it, then we can be a good employer and a partner in them with that.
That's great. So, I mean, Sammy, you mentioned the Workforce Board. That's a federally funded entity from the Workforce Investment and Opportunity Act for people who don't know that. And it's critically important that employers and educators play a role in that. So you all probably have a different perspective. So I'd like you all to weigh in on this. How did the San Antonio healthcare community react to this? What was their response when you kind of announced this and started doing it?
So I can speak a little bit because we started hosting healthcare collaboratives for the workforce board. So we brought in employers and I facilitated those groups. I'll tell you, and Carl said something like this, if you can show up. At the time, right after COVID, our healthcare employers said, if they show up, we're hiring them. Like that's how the need was. And we were hyper focused on getting them the talent as quickly as they needed the talent. And then as we've been going through the collaboratives, we've been getting more and more input from the employers of skills, employability skills. I think for the employer, quite frankly, if they're credentialed and they're coming out and they have employability skills and they're showing up to work, they don't really care who's producing them. So I think we think that sometimes, right? But if they're credentialed, they're trained, and they're showing up and they're a good employee, yes, we want the feedback if, for quality assurance, but at the time, the need for allied health and still now today for MAs, they're going to take them from multiple training providers. They have to, just like I was saying earlier, we can't be as higher ed, we can't continue to think we're the only one in the game and that we can save everything by getting bigger and bigger and bigger. We have to leverage partners. We'll never meet the full need just based on capacity, facilities, instructors, things like that. They're true resources. And when I talk about a student, my other process is the employer, right? An employer can't wait for us to produce at a trickle. They're looking at a scale that they need to have MAs come into that career. Because just like Carl said, right, they're going to move on. They're going to lattice. That's what we want them to do. Like we were talking earlier, right? They're going to go diagnostic, administrative, or direct patient care. And that's an opening now to get someone into that entry career field. So we're going to continuously see the need for that talent pipeline. And one institution can't do it alone. And the other thing I'd tell you is I think like workforce and workforce boards, a lot of times they're super siloed. And just like like a sum of disconnected parts. So one of my strategic objectives for being on the board is we got to get it together, put the pieces together. Find the funding for the employer, right, to meet the talent need, find the funding for the client, the community member that needs to be trained. That's our role in the ecosystem and to put the pieces together to make an impact.
It's great that you're on the board. Thank you for your service there, because
Thank
I know
you.
it's probably not easy.
No.
So Jenny, what kinds of response did you get? You had campuses in the area already, so you weren't a newcomer, but you were a different player. What was the response of the community when you announced this partnership?
I can tell you that everything has been so positive coming out of this relationship. And our main focus is really getting our students job ready. That is incredibly important for us. So we do train them. Obviously, they go through our program. It's a blended environment. But not just do they do their skill set on campus, they also have a clinical and an externship component to their program. And that has been incredibly important for them to really experience that environment and know what they're getting into and have that experience behind them. It allows the employers to really take a look at our students, right? And take a look and see if they're a good fit for their practice. And we really strive for our students, ideally is for them to have a job offer from that clinic experience. And our percentages are, usually like, in the 30s for extern to hire, depending on the campus and the program, which is really strong. So we really focus on that job readiness, and we want our students to, the moment that they step into that clinic after they're completed their education, to be able to be really useful part of the team. Carl just like he's talked how busy his practice is. They don't have time to go through the baby steps. You have to hit the ground running, and that's what we really focus on our students to be able to do. So we've had in the 35 years that we've been here in Texas, we have over 5,000 employer partnerships throughout the entire state. So we were intricately involved with our employers from the very beginning. So this has just been a natural extension of what we've been doing with really positive results. And I think Carl can speak to our graduates that he's hired, both from Alamo College and from CHCP. So.
Oh, it's exciting. So Carl, I'm going to ask you, do your peers, other private offices or the healthcare, anybody in the healthcare ecosystem in San Antonio, do they ask you if this is really working? Do they ask you like for a peek under the hood at this partnership?
I have had a few people ask about it, especially the smaller groups that are they're really struggling to find the right fits for their few positions, and that puts us at a little bit. We have to really focus on the right fit as opposed to being able to hire 30 at a time and see who the 20 are that stick. We're much smaller scale than that, so I've definitely been approached by folks asking about how to get more involved in that. And we like to do more than just that typical externship type of thing where some, we all know some practices that just go for that extern to do the extra paperwork and then move them along, and that's not really good for anybody. And so we specifically don't do that, and we intend to hire everyone that we bring in as an extern, and if it works out, it works out. But and sometimes if it doesn't, we can give that feedback back and say why, and talk about. And I've even been in positions where I've offered somebody up, they weren't a good fit for us for our practice, but maybe it was just because of a certain speed or maybe the language barrier or things like that. And I've told them to go refer them to other offices that might be better fits for them. But back to your question, like the types of programs I think are so beneficial to small employers. We just have to be willing to think outside the box ourselves. Sometimes it's different to be in these relationships. And when I a little business like me is engaging with a major institution like CHCP or Alamo Colleges, we're small fish in that pond, so to speak, at that moment. And so we have to be willing to take those risks and just like be a part of those bigger conversations and not be afraid to try things. I always tell people that we like to be a petri dish for anything else that's happening in the community. So we're willing to try anything at least once. And so I think everyone is interested in these types of programs. I think all the big employers are the ones that really show everybody else, like, hey, if Methodist Hospital's doing it and WellMed's doing it, I mean, they must be doing something right. So, but just can we do it as someone who's so small that I might have to be doing a little bit of the training, and the people, we don't have a lot of redundancy to be able to bring them in and onboard them. So we're doing a lot of it ourselves, and we have to be willing and able to do that. And every time we've done it, though, every time we've gone down that road, it has absolutely paid off, but in dividends. So, yeah.
I'm guessing you don't have a CHRO. You are the
not.
CHRO.
No.
So let me ask a question again of all of you. How do you keep the communication fresh? How do you keep a continuous feedback loop so that you're learning from your employer partners, but also learning from each other about your different models? Janeet, you want to start?
From the employer's perspective,
Oh.
my interactions with CHCP and Alamo Colleges have just been fantastic. I mean, both of institutions are really good about making sure that they continue the conversation. It's easy for me to get buried by all the emails and the daily hustle of what's going on and just on the day to day. And so I got to hand my hat to both of those institutions, because there's the folks that they've had engaging the employers like us have always been extremely professional, very respectful of time, but still, hey, reaching back out again just to see what's going on and making sure we don't miss an opportunity, miss a deadline, miss a way to work together, or being able to take the feedback of. There's been a couple times where I've just had to say, like, look, this particular person, they may be going through something. Now's not a good time for them to be working, at least with us. And so I'm just gonna have to ask you to take them back and find a different spot for them, perhaps. And that's not an easy conversation to have, but sometimes it's the right thing at the time for everybody. And so everyone's always been receptive to even those harder conversations. But most of the time, it's really about on my end making myself available and being willing to take on the conversations. And from the institution side, it's just you'll find the great people that are able to reach out to folks like us. So it's good.
Right. So I mean, it's relationships built on trust and like Carl said, a lot of communication and conversations. And sometimes the most important conversations are those that are hard to have when that student is not a good fit for a clinic. And that obviously it happens. We're human. Nothing is perfect when it comes to human and students. So, but it's incredibly powerful because it not only assists us, but it also assists the student. It's helping the student ultimately to get that feedback and say, hey, there are some things that we need to focus on, before you go on to your next clinic site, right? But really, in terms of maintaining communication with the employers and with Alamo colleges, it's different ways that we do it. With our employers, we have advisory meetings on a quarterly basis, and we invite the employers in the community to those meetings. And really the basis and the goal of those meetings is really to hear out the employer. How is our program working? Are you satisfied with the students that are coming to you? What else can we focus on? Are there things that you see that are gaps that we should be changing in our curriculum? Do you see something new coming out that we need to implement into our curriculum? For example, telemedicine, that was something new that came out during COVID. And there were, we didn't have that written in the books, in the textbooks for training. So that was something that came out of COVID that they were like, hey, we're doing this telemedicine. I think, it would be a nice introduction if you can, build it into the curriculum. And that's just one example.
Yeah.
So those are the conversations that we have with the employers. With Alamo colleges, like I had mentioned before, when their students came to us, we built reports out of our system that we could send them on a weekly basis in terms of attendance and how the students were doing with their GPAs. Obviously, we got permission from the students to do that ahead of time. But basically, that was a weekly communication to ensure that we were keeping tabs on our students, but so that they would have a transparency. They could see, listen, it's really working. We have some challenges. The student missed 2 days this week. We're contacting them. So it was a continuous communication for us. And I think as we build that trust amongst the colleges, I think it's only gotten better. The communication is much easier. We have a number of people that they can reach out to and communicate with at the campus level and our corporate level as well.
That's great. Sammy?
So for employers, we recently reorganized to have a business and industry solutions team that is account executives by sector. Because we're big. When I was talking about how large we are, what we saw is that employer partners are trying to figure out who to contact at our colleges or at the center. They don't, to me, that was too messy. So we put in a new model that by sector, we have account executives that they're the front facing. So they're going to triage an employer relationship to see not only maybe an entry level position, but also what other talent gaps do they have? So their role is to really figure out talent solutions for any gap an employer has. And then we come back as a team across the different programs that we have and say, okay, what do we have in the toolkit? Do we have everything in the toolkit or not? Is it an academic program? Is it a non-academic program? We manage the TWC portfolio for, adult ed, adult education and literacy, for skills development fund, for skills for small business. So we're triaging like that as a team now, where before we were really siloed. And then if we hard refer to the college to be on an advisory board or to be part of, Alamo on the Job, which is, paid externship type of things, we can do all that with one person. Because I didn't want, for instance, Carl to have to know 10 people. He probably still has to know 10 people right now, but we're going to cut that down. But I know who knows your Save Clinic folks, right? And I see them at our events as well. So that's one way over the last 9 months that we've gotten better at that, to teach my team too, right? Like that's your person, that employer's your person, right? We want to meet their needs. And then knowing what other, because think about this, CHCP may need an externship site. We know that they have more externship sites. I don't need them. How can I connect? And that's really to get our team to think through those type of possibilities over the 9 months, to me, has made a much better impact for our employer partners. And then for other training providers, number one, the city has really forced the issue too, I would say, because of Train for Jobs and then Ready to Work. Ready to Work approves different training providers. And so that approval of all of these training providers is also, it opens up to other partnerships in the ecosystem. And then things like the collaboratives that we're doing with the Workforce Board, and it's ongoing. I mean, it's a lot of work. But like I said, if we really keep the mission and the objective in the forefront, which is to eradicate poverty, then you're going to think like that in the puzzles and understanding who has which partnerships, relationships, and how we can leverage each other on the resources.
Well, I know you're not going to believe me when I say this, but we are almost out of time. So that flew, right?
Yeah.
I'm going to ask for a lightning round. You can choose, either give somebody a piece of advice about how to replicate this in their community, or tell me, if you had a magic wand, how would you scale this? And I'll start with you, Carl.
Oh boy, I should have better prepared for that question. But I think I'm going to go with the advice, because I think that as a small business, we don't see enough engagement from other small businesses in these types of programs. And so I would give the advice to any other small business employer out there that these engaging in these types of relationships is definitely worth the time and effort. It might take a little bit of figuring out how to do it, or what to, you might hit some road bumps along the way, but it's such a pleasure. I do know my people by name at both CHCP and Alamo colleges, and so I know that I can pick up the phone at any time and reach out with a question or concern about a certain job position, or a certain something I see coming down the road, and I can talk to them about preparing for that, and looking at programs that are available. And it feels very good as a small business that they're going to pick up the phone and talk to me as if I was the 1,000 employee employer in town, and they're not going to make me feel like I'm just a small fish in this big pond. It made me feel like I'm the most important guy in the room at that moment. So it really is worth the effort of the small business to take the time to develop those relationships, and to open the doors to the types of programs, and go ahead and bring them in-house.
Ladies?
Well, if I had a magic wand, Jane,
I'll send you
I
one.
I would really like to see some of the self-imposed barriers, do away with all those, right, across the board for educators. I think sometimes we're our biggest worst enemies. We think, we can't partner with that one. Well, no, we can't use that, that group, or, building a flexible pathway. That's not something that we do. I think I would like to see educators like wear their magical thinking caps on, more often, and not focus on all the things that we can't do and why we can't do it, but let's focus on all the things that we can do, right? The controllables versus uncontrollables. And there's so much that we can do if we're really open to, unnatural relationships, and open to really looking for solutions. And like Sammy says, if our focus is the student, and that continues to be our focus, that there are magical things that can happen really with certain collaborations.
Thank you. Sammy, last word.
Can I say ditto? No, John,
Yes.
I would say that, and I would, double down on everything that was just said, and then just get out of your own way, right? And remember the true mission. So the true mission of higher education, and what we are here to do for our communities, and to be a servant in that system, it takes taking you out of it, right? The ego of continuously building and building, whenever it really is about building the relationship to produce the talent that the employer needs, because it's both sides, right? The finding untapped talent in our community, educating and developing that talent, and then fitting that with our employers and putting that fit up front, right? And how we develop. So yeah, just definitely the forefront should be the true mission, and the true mission is socioeconomics for our community.
Thank you. I'll speak for the audience who we can't see. Thank you for such an amazing conversation. Thank you to the audience. And of course, thank you to Kale for always putting together great conferences.
Thank you.
Thank you.
You.